History has recorded similar health threats which have impacted the Bahamas as COVID-19 has. Associate Professor of History at the University of the Bahamas, Dr. Christopher Curry, recalls the cholera outbreak in the Bahamas back in the 1800s, which killed scores.
And the cumulative numbers were close to 700. You had over 200 persons in total dying in North Eleuthera, and then in Harbor Island you had similar figures. So that was a pandemic that actually spread across the archipelago. It wasn't just relegated to New Providence and Nassau. But 70 deaths a day, that's quite a large number. And that is why they created Athol Island as a quarantine center. It was immediately after that cholera outbreak in 1852 that they did that. And Athol Island became a quarantine center until the 1920s. And of course, it has since been basically destroyed. I would also add Abaco apparently had a cholera epidemic around 1855. It actually might have been related to the same strain that I was mentioning in 1852 and 53.
Now, Dr. Curry also spoke to the safety protocols now in place, stating that such measures were implemented after the Spanish flu outbreak.
We're starting to understand how you deal with pandemics by social distancing, and there was an effort to do that. But also, more importantly, people were understanding the importance of using masks and medical gear that would protect both the person that was infected and the medical professionals who had to deal with the disaster. And so I think it was really the Spanish influenza as the template for a lot of what we're seeing now in terms of the health practitioners determining how you handle pandemics when they start to spread like this. So I think a lot of people have brought lessons forward from those earlier pandemics.